Hey everybody, my name is Daniel Garza and I'm one of the Positively Fearless Ambassadors. Positively Fearless is a campaign that's redefining what it means to live with HIV and showing others what is possible when you live positively fearless. In case you didn't know, physical and health issues like HIV, anal cancer can create a form of PTSD, which is also diagnosed, was diagnosed several years ago with me. To kick off things today, I am joined by my friend Ruby Castilla for a special conversation about mental health. Ruby is a J&J Janssen Johnson director with an MD in psychiatry. So I'm going to bring her forward so I can show her. Ruby Castilla, hola, ¿cómo estamos?
Buenas tardes, Daniel. Thank you for the invitation. It's really a pleasure to be here with you and share this topic and talk about this important topic. Thank you for inviting me.
They are telling me we're having a little bit of issues on our YouTube page, so I'm going to take a quick pick before we start and make sure that everything's okay. It seems to be running good. There we are. Okay. Saludos. So for everybody, want to thank. I just lost the wording, so I'm gonna come back. But HOLA is a J&J program created by the Hispanic and Latino members of J&J. So we want to thank all of them for putting this together and making it happen. We already have a comment. Yay, Ruby, Dinora Villanueva, which Dinora Villanueva is going to be on our episode next week, our fourth series. So make sure that you join us for that. But antes de empezar, Ruby, quiero que les digas a la gente, tell us who you are, quién eres, and tell us a bit about you.
Thank you. I am a psychiatrist by training. I was practicing in Colombia before I moved to the States 25 years ago. And I have been working with different type of patients, but also I have been working in the industry. Now I am the director of the clinical development, and we are in the process to develop a product, important product for that is something that I am very proud of, to develop new medications to treat patients. But in general, I am promoting mental health in Hispanics, Latinos, and I think this is specifically why HOLA is supporting the initiative that I have, because I always try to promote mental health in the Latino population. I don't know.
And that's yeah. I was going to say that's really why we're here today, and that's one of the important things that we want to talk about. Which the title of our show today is Mental Health Secrets, and we're not going to reveal some big secrets to everybody. So that's not what the show is about. Pero más que todo, los secretos que guardamos en la comunidad latina y hispana, all the secrets that we keep to ourselves that we don't talk about. For instance, let me tell you a little bit of my story, and then we'll fill in some of the gaps there. After living with HIV for 21 years and cancer for the last 6 years, well, I'm cancer-free at the moment, there are still a lot of issues that happen. For instance, being diagnosed with AIDS, the stigma and shame and secrecies that came with that. People don't think or don't consider the fact that having family or friends put me aside or belittle me or not talk about HIV with me can create some mental effects. And I've always said that that first year, it's kind of like a child, that first year of being diagnosed with whatever illness are very important for the mental health of the patient. What do you think about that?
Yes, definitely. This is very important. This topic, Daniel, that you just mentioned, the first is the prevention in mental health. Mental health prevention is that. How it's not important the diagnosis. We have the condition, but it's really not important. The important piece is how each individual can be able to handle this condition the rest of their his or her life. So it's not important really the diagnosis. It's important how we can learn from this diagnosis and how we can handle from the all the life, and how can I it's not what define myself I do have a depression or schizophrenia. No, no, no. What is defining myself is how I am able to handle this and learn about the condition and all of these things. So I think that I don't know if this is what we were talking about, how we need to talk more about the mental health, because usually, especially in the Latino community, we are willing to talk more about the physical health, but the mental health is something like it's a secret, it's a taboo, is something that the stigma is huge in the in general, but in the Latino community we have a huge stigma. So,
Right.
so it's important to talk more, to put in on the table always physical health, important mental health, both they are together. They are
Porque
important.
cuántas veces, how many times, I know I heard it, like I feel sad, I feel depressed, I don't feel well. Pues ponte a trabajar, go do something. Uh, it was always brushed away. My dad's thing is like, a nosotros no nos da eso. Like we don't get that. Like we don't get depressed. We don't get sad. What are you talking about? I know this is the $1 million question, and we probably don't have the answer today. But in your experience working in the Hispanic community, ¿por qué? Why are we so afraid to talk about mental health problems?
Very good. The issue with the Latino community also is not only we are facing an issue in general, not only the Latino community, is the stigma about mental health. And it's across all the ethnicities, and it's not only from the Latino community. But what happened with the Latino community, what happened with us, is that our culture has we have in the we have certain specific issues in the culture. For example, we have the opportunity to analyze recently more than 500,000 conversations, 500,000 digital conversations of Latinos. And we were able to identify that, for example, the Latino community, they don't believe in the depression. They believe depression is not a disease. Depression is part of your life. So you have to pass through this, like you pass through the adolescence transition, like you pass through the menopausal transition. But if you don't consider depression, I am talking about the disease. I am not talking about one day that I'm sad for this, or I am not talking about because I lost a family member. No, I am talking about real disease, the brain condition. So this is important because we need to put the condition where the organ is in the brain. So they are causing issues, and we need to be sure that we understand the condition. Part of the psychoeducation that we try to do with the Hispanic community is to teach them that this is part of the body. The brain is part of the body. You cannot separate those.
Sí.
So probably more psychoeducation. We need more and less try to mitigate the stigma around that.
Yeah, porque por decir, talking about HIV, and we have a question about that I'll bring it up in a minute. Talking about HIV, like when I was diagnosed with AIDS, which we know can produce some mental problems, and it's long lasting. It doesn't just go away. And then cancer, chemo brain, like it's a very common term in the cancer community, chemo brain. And people are like, what is that? It's like when you've gone through chemo or radiation, se te queda, it stays for a while, and people don't believe that, which for me, I'm a busy guy. Like I'm involved in a lot of things. Pero at the end of the day, ya en la tardecita, when I've been working a lot, I to forget how to put the sentences together, and I start to forget, and then that frustrates me, and then it channels to I'm feeling upset with myself. Y luego solo me estoy pegando. I can't. But there is a big connection, right?
Absolutely, absolutely. You just touch something that is really important to understand, how the immune system, they are very connected with the mental condition. So for example, people, it is well identified. We probably had the opportunities to learn this before because we had not the technology. But now with the new technology where we can study more the conditions, we learn that they are a very close connection between the immune system and the mood of the people's depression, the major depressive disorder specifically. We have learned that they are a very tight connection with all the immune system. So anything that can cause decrease in the levels of the defense of the I am trying to los lymphocytos, all the cells that they are that we have, and we try to increase those in order that they have a good defense. Sometimes those they are with the depression. We know that they are decreased, has been very well documented, not only for people with HIV, with cancer, but other conditions, infection diseases. We know that the risk for to have an infection disease, agrippa, is more if the person is depressed. And there are very interesting studies in Pittsburgh. There is a very good set of studies that demonstrate that is really a very tight connection between the immune system and the depression.
And we've joked around on some other conversations, but los Latinos somos perfectos as Latinos. I know in my house, like, algo me está pasando, ponle Vicks y te alivias. Y no esto me siento bien, ponle esto y te alivias. Tómate un tecito, drinks it. But something that I'm not personally attached to, but new mothers, postpartum depression. Like, I know a lot of my Latina friends who have gone through that, pero estás cansada, you're just tired. Like, you don't have mental problems, you're just tired. But we want to wash these away and not really connect to them. Before we move on to that, we do have a question that came up. Is there any research on the psychological connection between those who are diagnosed with HIV and then do not seek medication due to the lack of communication in the family? Is that denial?
Yeah, very good question. I think this is important also to say that I have been very well designed studies showing that there is really people that they have HIV and they are they don't have a good communication with the family. They are in some ways disconnected, isolated. They are losing interest and pleasure in things that they usually enjoy, and they are really facing. They can face in this moment or in this situation major depressive disorder, and they need to receive treatment. The treatment is something that it can be. It depends of how, where, and the resources that the people of the family they have. They are different type of treatments available. But to respond this question, yes, they are a psychological. There is a psychological connection between that. Some people they have HIV and they don't see medication due to their own lack of the self-esteem. Is the they don't believe this is a hopelessness. They don't believe they have a hope. The disease, the HIV, I am going to die. All of these thoughts of death that they are associated with the depression. All of these lack of energy, appetite, that they don't have a good appetite, they don't sleep well. All of these criteria that we have is not more than 2 weeks that you continuously are doing repetitive thinking, lack of interest in pleasure you usually enjoy. You have problems in the job, with the family. You are irritable. You are really not pay attention to things, and you have to consider depression. You have to be able to say, probably I am suffering of a disease of the brain. So I think that it is really important to consider depression, to consider this is specifically the depression, because it causes a lot of problems, cardiovascular problems, immunological problems. So this is really important to identify.
That's really interesting. I want to talk more about that. Let me just bring up, you are watching a special issue It's Hispanic Heritage Month, and today's topic is mental health secrets, a series part of our particular conversations series. So make sure, but as a reminder, we asked you please refrain from discussing or asking questions regarding personal medical histories, or specific treatments. If you have treatment-related questions, we encourage you to speak with your healthcare provider. What may work for some people may not be right for others. So let's just keep the more specific stuff. But please continue to ask questions and make comments, and we'll make sure we bring them up so that we can notice them.
Daniel,
Otra cosa que, go
yeah.
ahead.
No, Daniel, I was thinking that one of the questions that also that why we are focused on mental health in the context of HIV care and prevention. And there are basically a lot of studies, significant studies show that there is a gap between the treatment. So, for example, people that they have a mental health problems. This problem influence every step in the treatment of the HIV. People at risk, they can be, people with HIV can significantly higher rates of mental health symptoms and disorders. And why this happen? Because there are connections, like I say, between immunological system and the neurotransmission. So the brain and the immunological system, they are very tied together. And sometimes the human people, we don't have, as a human beings, it's very hard to accept that we have a condition, especially mental health condition, for the stigma. And I think that this is something that we need to consider always in our families. Talk about this. Yeah.
Una de las cosas que yo he oído, one of the things that I've heard growing up too is like, we can't afford mental health problems. No tenemos para comprar salud mental. And because that leads me to one of my next notes is religious, cultural, social norms, todo eso, la religión, la cultura, las normas sociales, that all also affects the way that we talk about mental health. Because as religiously, como católico, it's really easy for me to go talk to my priest about things that are happening to me. But they're not psychologists, they're not therapists, they're just going to give me religious advice. Pero que me digan, ve al psicólogo, go with the psychologist. Oh, no. ¿Cómo voy a contarle los trapitos al aire? No, we're not going to put our dirty clothes out there for people. As somebody who works in the mental health community, is there a way that you've learned, or is there a way that you know that we can like step over those religious cultural norms?
Very interesting and very good question. When you learn that the mental condition, the mental illness is a risk factor, for example, for HIV acquisition, if you have more risk, you have to acquire HIV if you have a mental illness, and has been demonstrated mental illness contribute to approximately 4 to 10 times increased risk for that you are going to be acquiring HIV. So it is very important to keep that in mind, that they are not really independent of the culture, religion. You have a body, you have, that there is a tie to your mind, and they are really important, those together. And if you are separating them, that sometimes we focus, and it was one of the first statements about the importance, not only focusing in the body, but it's also is a continuum, the mind and body. So when we put in the place where is the condition is, where the mental illness are in the brain, and they are not because we have people or parents that they have we were abused, physically abused for the parents. That is something that there are some personal things that can predispose you, and I think that, Daniel, you mentioned also that you suffer of PTSD because you had these conditions, had cancer. just to have one medical condition can predispose you to a mental condition for PTSD, for example, and has been very, very well documented. So there are a lot of comorbidities of physical health and mental health, and it's important to address both. Because if you do not address both, you are not really seeing or holistically the body, and the treatment could be not a good treatment. If you don't consider both sides.
So we have a couple of questions on the board for you. There's the first one. What projects are there being implemented within the Hispanic communities to try and enlighten and change the social cultural norms that have been handed down through generations? Yo siempre hablo de eso, de que hay cosas que fueron engendradas que son de mi abuelo a mi mamá, de mi mamá a mí, like all these things that I've handed down that I've been, even as a first generation 50-year-old man, there are still things that mi mamá me decía de niño that are still in my head that I can't fight. Do you work with that?
Yes, very good question. We are working. I am the president of the American Society of Hispanic Psychiatry, and this is part of my volunteer work from Johnson and Johnson. I provide services to this NGO, and through this community of mental health professionals in the in US and Latin America, we provide information and education mainly to the Hispanic community in Spanish. And let me tell you why. We were trying to learn what the needs are, how we can be more proactively providing services to the Latino community. And one of the barriers that we face is the language, and it's very high. So to change the ideas, or to change the way that our parents, our or our grandparents, they were thinking, we need to educate, the community. And how we educate the community in Spanish, we have to talk with them. So we develop, for example, a series of a speaker series of mental health in Spanish, and we have every single month, and this is part of what we need to do, and is to talk in Spanish and to present a case of one teenager that had this and this, and open the floor for questions. And we don't treat patients directly. We are not really able to do anything immediately, but we can provide some tools to the people, and sources of information where they can see if they need help. They can reach out for help, independent if they are legal or they don't have insurance, or they are resources available. And sometimes we don't know about those resources. So I think that we are doing something more adapted to the communities in general, not only Latinos, but the community of color, for example. So we are trying to do things that they are really appropriate to the community.
We have another question here for you, Doctora. How would you describe to have a dialogue with family conversation Latinos population about mental health and HIV?
Very interesting.
Otra pregunta grande, ¿no? ¿Y cómo le hacemos?
Yes, and one of the things that I have learned through not only the practice in psychiatry, but in general, I had the opportunity to treat many patients and families in Colombia with lack of resources to provide to these patients. And one of the important points is to open the dialogue between the families, between that this is that we can support the family as a physician or a mental health professional. You can provide this setting, the forum where you can explain directly the family, but also to be like a buffer, between these. They are a lot of probably is fear, anxiety between the parents. Sometimes the parents they are depressed. Sometimes they don't identify that they are suffering also. So some conditions that can be treated, anxiety disorder. So if we can identify in the family things that we treat both parents and they receive a treatment of the family. But my advice is that they always reach out for help, reach out for support of a mental health professional. You can call a psychologist, a counselor, some people, and they can direct you to the right treatment. Not necessarily, I am not saying that you have to send or you have to go directly to the psychiatrist. Probably there are other ways to reach out for help. But my point is that the families with that they are living with HIV, and they need to talk more about this. They need to talk about it's a stigma. It's the same thing. It's like we add to the equation of the stigma in mental health, the HIV, but the stigma is for also to talk about the mental health or the mental illness that probably people, families, they are suffering of some conditions and they are not aware of that. And they can receive treatment, or the family therapy, or you know what I mean. So I think that reach out for help is what we need to do.
So I left this comment out. First of all, I want to say hi to Jose Carrera Rivera. He was our specialist and speaker on the last two episodes. So if you have not watched the HIV and cancer episodes, go catch him on there. He is brilliant. And yes, we need to normalize. No normalizamos. Which brings me to this next comment that I have on the board. Un problema muy grande que veo yo es que para una persona con depresión es difícil aceptar ir a buscar ayuda profesional, y más cuando hay muchísima gente que no acepta que es una enfermedad y juzga y espera que uno solo se cure de la depresión. So for those of you in English, one of the biggest problems is that when a person is depressed, it's difficult to accept help and seek professional help. More so when a lot of people do not accept that it's a sickness or a diagnosis, and you are being judged. We were talking about stigma just now. And then they expect you to just shake it off. ¿Cuántas veces we didn't hear that? It's like, te va a pasar. It's going to pass. But ¿qué triángulo se formó? No, like it's that triangle. Like, I have a problem. Nobody believes me. I'm all by myself. I have a problem. How do you get out of that?
This is a very important question, because this is really one of the challenges that we face as a physician and psychiatrist, is to treat people that they don't believe they have that condition, especially the depression, that when you don't believe that you have that condition, and you don't believe that there is a solution. That is the worst scenario for our Latino community, is that we don't believe that this depression has treatment, and you can receive treatment, and you can receive a good treatment, and you can be fine and independent. If this episode of the depressive episode repeat, you can learn how to treat, how to receive treatment, and how avoid a recurrence of the episode. But to answer to your question, we need to receive the support. Or what is important is that we have to see what is the environment of this person. What is who this person has, any friend, has any family member that we can, as a professional, use or receive that person can receive support through a friend, through a family member, so sometimes they don't, when we have in front of us a patient with depression, as you mentioned, they are always a negative thinking, their life, we don't have anything to do, I am a failure, I don't want to continue with this. So when there are all these neurotransmission in the brain is decreasing the serotonergic system, and you can see when they have obsessive ideas about the war and the things that they are going to be that they are not realistic. You can see this person has a very good support, family support. He came here with two sisters, and now I have to learn about what is the support of this person. Probably he's alone. Probably it's just this person has no one around him or her, and this is the challenge. You know how you approach one person that, first of all, is not has no idea that he or she has this condition, and second, is not willing to receive, or is not because the condition, the same disease, is not because they don't want, it's because the same depression is affecting in some way the treatment, that they don't receive treatment because that. So they are really challenging things. What we try is to use all the resources that we have. If there is a neighbor, if there is somebody, if there is internally in the clinic or in the we have people that they call daily to some patients, for example, and just the voice of one person, we are going to call you at 4 p.m. At what time is good that we called you? And only to hear a voice. This is the power of the human voice that is very important for many prevention things. That if we receive a call, some of the patients, they say, I was sitting in front of the phone waiting for the call of a person that is not a family member. Is a person that is part of our clinic, and he or she is willing to help and call and talk about how it was your day. Sometimes when we don't answer, when the people they don't answer, it's hard, because it's part of the condition. So we try to be close to the person in order to provide the support that they need. But it's really challenging.
Before I make my comment, I remind we're halfway through the show, and just reminding you as a reminder, we ask you that you please refrain from discussing or asking questions regarding personal medical history or specific treatments. If you have treatment-related questions, we encourage you to speak with your healthcare provider. What may work for some may not be right for others. And I want to appreciate everybody who's joining the conversation. Gracias por las preguntas. Thank you for the questions and the comments. They add to the conversation. We want to hear from you, so please continue to comment and ask questions. One thing that I just wanted to highlight, algo que usted dijo, es eso. It's like, first of all, yo, Latino hombre, just to approve, just to accept the fact that I have an issue. Okay, I have an issue, and then I am going to take myself. Voy a ir a una clínica, voy con un doctor, voy con alguien. Okay, that's my second step. Y luego ya llego ahí y me dice, no tienes nada. You're fine. But you don't have a problem. You just need to exercise more. You're just overweight. You're alone in this country. You don't have any friends. And you're like, okay, so I made the effort. Y ahora nadie me cree. Nobody believes me. And then that takes us like not even back to zero, beyond zero. Does that make sense?
Yeah, you have a very good point, Daniel, and it is unfortunately the stigma of mental health exists in all levels: patient, healthcare workers, policymakers. There are fragmented service delivery. Sometimes we don't have all the model of our current model of delivery service is fragmented, and we don't have the capacity to follow closely these patients, because they are lack of resources or for many reasons. So what we trying to implement is to that the people, they don't blame the patients for the condition, the psychiatric condition. Imagine, I always say, imagine if you got blamed for having cancer, or for having diabetes, or for having hypertension. It's the same thing with mental health. And also to really, or to educate the parents and to say, you are not, don't feel guilty about your child or your son or daughter that has this condition, because you are doing the best that you can. But there is a genetic component. There is a family run in the family. Some of these conditions they run in the families, and but the important is very important to educate the people to that they learn that this condition exists and they have resources that we can reach out where we can reach out for help.
Yeah,
But
that's
they are
really interesting that you say that because HIV, anal cancer, and a gay man. Um, these are certain things that there have been people who have said, "Well, of course, like, of course you have HIV. What? Or of course you had anal cancer. You're gay, right?" It's like, well, yeah, but it's not like I signed a report, like a menu order. Oh, you know what? At 30 years old, I want to be HIV. At 45, I want anal cancer porque hago estas cosas, dámelo. And that people don't realize. I consider myself a pretty strong person, pretty understanding of mental health and going to treatment, but it does affect you. Sí me ha afectado. Like it has hurt me in a way. I mean, and it took me a long time to realize that I may not show it right away, but over years, it's una semillita. That little seed stays there and it grows. But not everybody has the capability of understanding. I need to go talk to somebody, which leads me to my next point. How does the two culture life affect us mentally? A los latinos, que por si nacimos en México o otro país, venimos a Estados Unidos, ya sea que somos emigrantes, documentados o no documentados, papás con hijos que nacieron aquí y están tratando dos culturas, they're trying to forge. How does that affect mental health? Porque nomás diciéndolo, it messes me up right now.
and there are really fascinating studies. Just few of my colleagues in the American Society of Hispanic Psychiatry, not few, they are now more and more, but at the beginning of 20 years ago, just few people were interested in to learn these differences. What happened with these Latinos, Hispanic from different countries, for example, how they address things and how their approach, can be different. So one thing that is important, Daniel, is the education is very critical. So if you need to put in the same, when you are going to analyze the differences, you have to put in the same level a specific characteristic of the person. For example, what is the education level, socioeconomical status? What is the family? It's not the same thing if the family has been passing through a lot of issues, coming the death of the mother during the time that they were walking through this country, or the death of, they are different aspects that we never consider, and they are important because they are some traumatic events that not all the people they have the same number of traumatic events, and the number of traumatic events impact what is the mental health. So one thing that is important is to study the population, not all together, but in general, what is to be a Mexican here, the second generation, the first generation. Also, there are many questions related with that. And now with the new cultural psychiatry has been studied more and more, and they are different. But basically, the main difference, Daniel, and how we need to compare between the countries, specifically if they are coming from Mexico, Argentina, Chile, where there are some differences between them in terms of how they approach things. But the main thing is the experience, traumatic events. If they are, one person have been experienced 10 traumatic events, another person have been experienced 2 traumatic events, you cannot compare both. And they are coming from the same, but they are coming from Mexico. But no, one thing is, causing more problems because there is part of the history of this person that is individual, it's not just for groups. So the best things to analyze this data is through the education level and a socioeconomical status, because they are really part of what we need to consider when we analyze. I don't know if I answered your question.
Yeah, exactly. I always like, and I say this because my parents, by the time we came to the States, we were documented. But my dad had like his own issues with police and the government, so he just passed that on to, well, at least to me, like don't trust these people, don't trust those people, and I always thought, but we're documented, we're legal, like we're okay, like why am I afraid? Why am I scared? And I grew up with that fear, and really, like, that's what, until I started on my own and lived on my own, I was like, and then I started advocating. I'm like, these are not bad people. Like the government is not out to get me. Like the police is not always out to arrest me. Otra cosa que también aprendí, something else that I've learned, is the structure, because we always talk about white privilege. That's a big thing lately. Pero también there is a Latino privilege. There's the Latino who is immigrant, monolingual, undocumented, who's had a hard time. And then there's somebody, and I do consider myself privileged. I'm bilingual, documented, I'm educated, I have a good career. Like there's difference. Pero también it creates a mental problem, like a disconnect. Yo siempre me he creído, no, pues yo soy de México, yo con todos. But then I go somewhere where people who are not at that level, and it creates that mental, and it has affected me, because I'm like, am I not Mexican enough? Like, what, ¿qué me pasa? Does that make sense?
Yeah. And it's interesting because, Daniel, I learned through studies from the Bellis. It was a psychiatrist that more than 20 years ago studied what happened with children. Like when you mentioned my dad was telling me about the police and all of these things, he was the first person that investigated what happened in the brain with a child that has been experiencing some traumatic events, and there are changes. So not only traumatic events, some events that probably they can influence the way that the brain that is in development, they react against all of these events. So one important thing is to prevent the condition, the mental health conditions in the generations that they are coming from different countries, is to try to protect them for the traumatic events. It's very hard what I am telling, but it is important also to understand that every single traumatic event, especially in early childhood, impacts the brain, has some issues, some important sequelas in the brain that you, after time and time, they are coming up. So they are very well developed studies of people that have been followed up for many years, 20 years, and they discovered that there are some issues related with traumatic events in early childhood. So one thing that is important is to try to educate the parents. That the physical abuse, and sometimes people say, why you are now saying that we cannot be doing some of that we just talk with the patient or with the
Children.
son, or no debemos golpearlos. We cannot,
la chancla, la famosa chancla, que siempre hablamos de la chancla.
We say no, the chancla is not accepted. So why that? And it's because we have been learning that the chancla can cause effects in the brain of the individual, probably not physically, but in the brain can cause disbalance in some substance that with the time you can see people, they develop some condition, PTSD, or say they develop ADHD or other conditions due to that, specifically to those traumatic events. So we have to prevent that if we can't, the best that we can, protecting the children about those.
No, and that's a whole other episode. PTSD and ADHD Es
Yeah.
toda otra conversación que nos echamos otra hora. Johnson & Johnson, we need another hour just for that conversation. So here's another comment here.
Okay.
In the existing program structure, is there a house call structure to compensate for the fear of going to a formal facility, particularly for non-residents? That's a really interesting question.
Yes, they are really, and it's very hard. I don't have answer for that question. It's really the system sometimes, and it's coming back to what I mentioned before. Sometimes the same the system that is not well structured, the is causing all of these problems as well. We don't have a good system that takes in account all the pieces, important pieces, and probably we need to develop a better policies in terms of how we treat mental health condition, because the system now is very fragmented and has something that we need to address. But I really don't know how, to be honest with you. They are really many factors influencing this, and I don't think that we have one answer for that question. I think that it depends on where you are seeing that.
Yeah. On a personal, what I can say on a personal, it's really based on what area of the United States you're in and what nonprofit organizations are available in your area. That especially during COVID, we're able to provide services and assistance to non-documented people or immigrants, especially through internet, like Zoom, to offer them the assistance that they need so that they didn't have to come to agencies. But that is a big fear, especially here in Southern California. Uno de los grandes miedos, one of the big fears is going to an agency, being not documented. La gente sin documentos, ir a pedir ayuda a alguna oficina gubernamental, siempre es un temor. But we work really hard, especially the organizations that I work with. We work really hard to reassure them that they will not be targeted, they will not be reported, that we are there to provide services. But that's really your local entity.
Very good point. Very good point. Because now that you mentioned that, I remember that they are organization. For example, the National Hispanic Medical Association. They are some organizations that they are working specifically towards that. How to improve that and how to be sure that all the people, independent of how the status is, receive the attention or the treatment that they deserve. So, yeah, it depends of where. Also.
Where you are, yeah. So we are just past the 45-minute mark, and this is a part of the show donde pedimos palabras sabias. What words of wisdom do you have for the audience, Ruby?
Yes. One important thing is to elevate the conversation about mental health. We talk easily about physical health, about diabetes, hypertension. So we need to talk more about depression, about thoughts of suicide. They are hard conversations that some people, they say, if I am talking that, I am putting the thought to my son. No, you have to explore. What are you thinking? You have to talk more about mental health. You have to learn more about mental health. Is the time, the first thing that always I try to say is learn about mental health. If you learn about mental health, you can identify things and you can say, no, this is abnormal. This is not abnormal. This is a threshold. This is something that is really passing the thresholds of normality. That is very hard, very, very hard to say what is normal or abnormal. But if you elevate the conversation, if you educate the people in general, the Hispanic community, for this reason, it's important that you listen all of these new resources that they are talking in Spanish, the speaker series in Spanish that you have, and I can provide you the link of we monthly have those conversations. But my first thing is we need to talk more about mental health. We need to talk more about depression. We have to talk more about other conditions, the PTSD. We need to talk about how to prevent abuse, physical and sexual abuse in the communities. We need to talk more about those topics and elevate the conversation.
Excellent. Thank you. I think that is so important porque de joven, when I was young and I was stressed and I was feeling not well, especially dealing with my sexuality and dealing with my community. And a lot of times, like the common answer was, ¿por qué estás deprimido? You're only 15. ¿De qué tienes de estar stress? What do you have? How can you be stressed? You're only 14 years old. Like, what do you have to be sad about? And that, I think that creates that, like, you're right. Like, I'm only 14. What do I have to worry about? Like, I shouldn't have to. Y vas creciendo, and you start growing up, and that idea doesn't go away. We keep believing that I have nothing to complain about. ¿Qué tienes de qué te estás quejando? What are you complaining about? And we don't always, and I think it's just the culture, we don't believe that our words leave trails or fingerprints. They don't leave a fingerprint behind, and they do.
Yes, I think that other thing that I would like to say is that there is a movement, a positive psychology is called, and it was developed in Philadelphia in the University of UPenn, where we need to learn how to see things positive. Always we have, and we were talking before of the show about this, how we can change the way that we Latinos perceive life, that always is a side, the coin has two sides. So you need to be sure that you not only are looking one side, but there are other things that they are coming for the other side, and you need to learn about this. Because sometimes you don't, if you don't learn this, that sometimes the mental health or the psychiatric conditions, they are part of this other side of the coin, but other things, positive things. This person is very is suffering of schizophrenia, for example, but also or is suffering of HIV with depression, but this person is very smart. This person is able to recover quickly for every. So the positive things that this person he or she has, we always need to see this piece, not only the negative. The community, the Hispanic community, always we are seeing negative things. No. You have to learn how to your thoughts, positive thoughts about life in general, and change this shift about all negative.
We still have some time, so here's another. I don't have this on my list, but I just thought about it as we were talking about positive thinking and changing the way. ¿Dónde cabe? Where does it fit in all of this, in this equation? Hobbies, pintar, bailar, drawing, meditation, porque también son cosas que como latinos no pensamos. O sea, voy a meditar un ratito. ¿Cómo que vas a meditar? What do you mean you're going to meditate? Voy a pintar para calmarme. Voy a cantar. Voy a bailar. Where does it fit in our culture?
This is a really, really interesting question, and has been very well demonstrated that all of these things that you mentioned, meditation, you can change the neurotransmission, and have been demonstrated that with the new technology that you can change some of these, the exercise. We recommend people with depression exercise routinely every day, because there are some also food. There are some neuro transmission that is affected, or the precursors of serotonin, for example, they are in the chocolate, in some food that you are eating, and you need to learn more about that. You need to learn more about what is available and how you can use all of these. The music therapy. I had the privilege to learn about music therapy when I was in training, and it's a tool. If you can develop that, people with psychotic disorders, the worst things, hallucinations, like delusions, if you sing the songs that they like, they are not hallucinating. So they are you put them in an environment where you can sing with them the songs that they have, they are passionate about this music. They don't, hallucinate, at least for this time, 30 minutes that we are singing, they have no hallucination or delusion. So they are tools. And I think that they are important to develop this. What other things may flourish this person, not only the disease, but other good things, like you mentioned, the arts, the music, all of these
Yeah,
things.
because that's not something that we were introduced to a lot as kids. Sí, hay fiestas y cantamos y bailamos, but we don't think about that as medical treatment. Pero para una gente, like for me, I don't have a great knees for running, but if I'm editing a video at home and I can disconnect from everything and it relaxes me, it makes me feel so much better. Like I feel so productive. Aunque le voy a tomar en cuenta, dijo comida y ahí me prendí yo luego. Like we don't really think qué tan importante es el cafecito en la tarde con la familia, un panecito sentados. Man, that just like I think about those moments and I'm like, it just fills me up, right?
Absolutely. Yes, absolutely. And there are some also ways to demonstrate that there are some specific structures in the brain that can produce circuits of hope. They are new development about this positive psychology, where have been demonstrated that these dorsal raphe nucleus, that is specific anatomic structure in the brain that produce helplessness. But if you can, by default, when you born, you are, you don't develop these circuits of hope. But with the time you have, through that you just mentioned, the coffee and the talks, that they are relaxing and they are, talking about life and about other things that probably some people just pray. Some people, the power of not the religion per se, but spirituality. Have been demonstrated the value in mental health, and we need to work more in that sense as well. That is important, not only the medication, but also other things that are coming in life.
Yeah. Especialmente saliendo de todo esto, lo que es el cierre de COVID, coming out of the COVID-19 lockdowns. Como Latinos, we miss that interaction with other people. And if you already have, I'm gonna assume here, if you already have depressive tendencies and you are then forced to be locked down, that can cause more problems. So now that the doors are opening again, please take advantage of that and reconnect with people. Does that make sense, Ruby?
It does. It does, but also the connection that we learn, another type of connections through other systems, the isolation. We have been studying also the isolation during how this affect, especially the geriatric population, that they don't have access to this technology, so yes, with the isolation, or the feeling of isolation, you can avoid, usted puede evitar eso haciendo otras cosas. You can use other techniques in order to avoid the feeling of isolation. That is what is causing problems. So yeah, and with the COVID, we learned another things. They were not only the negative things. We learned things that we probably otherwise, if we had been with no COVID, probably we didn't learn about ourselves, our family, how to be in a place where you cannot get out because the risk for to be infected. So all of these things put the human beings in general in a position where they learn other things as well. So this is the positive thing about the COVID, that it has a lot of negative things, but there are some positive things around the COVID as well.
Pues nos acabó el tiempo. We're running. The conversation gets so good. We need another hour with you, Ruby. Toda una hora más de Ruby. I want to show some websites that you guys can go check out: American Society Hispanic Psychiatry.com, which Ruby is the president of. So make sure you go check that out for more information. También the WamiMentalHealth.com. Go check them out for information. If you want to connect with Ruby, go find her on LinkedIn. I know it's pretty long, but this is her link page. So just look up Ruby C. Castilla Puentes and you will find her. She'll be on there. I want to thank the folks, the J&J Hispanic Employee Resource Group, HOLA, for making this show possible. Thank you guys for all the work that you're doing. Also, Positively Fearless, you want to know more about us, go check it out at the website. Ruby, anything else before we go?
No, thank you. Thank you for the invitation. And definitely we need to talk more about this. And it has been a pleasure talking with you today. Thank you.
And a todos ustedes, all of you that contributed to the conversation today, thank you so much for watching. Remember, next week is our 4th episode in the series, which will be about stigma and shame in the Hispanic community when it comes to surveys and studies and participating. So make sure you come and join us next week for that one. Same time, same channel. Come check us out. But for now, I want to thank all of you for joining us. Thank you, Ruby. It was a pleasure being with you. Don't go anywhere. Let's say goodbye to everybody. And we'll see you folks next week. Bye-bye.
Thank you.